perfect place to... Okay.
Sorry.
All right, so first off, one thing we would use this model for, of course, is the layers. So, what would you say is the name of this layer, all of this beige from here to here? Mucosa. This mucosa specifically has these big bumps named what? Villi. Good. On the inside of these villi are these structures, lacteals. Okay. Well, what we can also see in the mucosa are these structures here. Intestinal crypts, exactly. So little invaginations where mucus is made in there. All right, so that's everything for the mucosa. The layer itself, mucosa, the villi, the lacteals, and those intestinal crypts. All right, so mucosa, check. That's everything for that layer. That's a Peyer's patch, but you're not responsible for it. Okay, what's the white layer? Submucosa. Where there's a mucosa, there's always a submucosa. Okay, what's always then in the digestive tract? What's underneath the submucosa? The whole thing? Muscularis. However, the muscularis has two parts to it. What would be this portion of the muscularis? The circular, and whereas down here is longitudinal. My way of remembering which is which, notice how the longitudinal layer has fibers going along the length of the model. Great way to remember. What would be the bottom layer that's then not shown on this model? Serosa. So if you have a written question, you should know that after muscularis comes serosa, but this model doesn't show it. That's it, this model, check.
That's it?
That's everything on this one. It's just the 4 layers and those few specific structures. It's really not a bad one.